Good afternoon. It is about 1 o'clock here in Central Time in the United States, and this message will be going around the world because I feel that it's time as a cardiologist to let my patients know, and anyone else who's watching this, about what is the situation with the coronavirus here in the United States, as well as what can you do around the world. First of all, to my patients, I want to tell you that because I love you all very dearly, I want you to know that certain techniques of isolation are important at this time. If you are definitely feeling ill, if you have fever or cough or shortness of breath, you must take heed to the guidelines established by the nation and where you live to isolate yourself, to protect yourself as well as others. The coronavirus has mutated. It's been something that's been around for quite some time in many other forms, but this type of corona is something that came from the animal, and therefore we don't have the immunity that we need. So that's why we have to do isolation techniques so that the illness can run its course, and many times it can be a very mild case. Other times it can be very severe. And the risk factors, of course, are hypertension, diabetes, older age, cardiovascular disease, among many others, respiratory illnesses. And so it's very important for my patients, especially because I'm a cardiologist, and my patients should be taking heed not to expose themselves. I urge them actually not to come to the office if they don't have any need to do that at this time, because I am able to see my patients on telemedicine. So telemedicine is now available and really recommended by our government officials to do that so that patients can be seen at home. I can log on to the computer, see you through your computer, or see you through FaceTime, or other modalities where I can actually see you or even just talk to you if you don't have any of those capabilities. So do not fear. Call the office. You guys know the number. It's 281-866-7701. And that way you can get the staff member. Tell them that you want to see Dr. Varughese on telemedicine, and they will put you on the schedule, and I can see you accordingly. I can see you day or night, and according to the schedule, you just let me know so that I will have that available on the calendar just for you. And I would like to spend about 15 to 20 minutes on each visit going over your chart, going over your details, what's happening to you, and refilling medications, taking care of your needs. If you have an acute situation where you're feeling unwell, please go to your local emergency room and let the medical staff there take care of you. And of course, they will be discussing with me, and we'll take it from there. So now for patients, around the world, I know that everyone is very fearful of what's happening around the world, and first of all, we need to stay calm. This is a virus. It can be treated. So now we know that chloroquine has been shown to be very beneficial with 100% efficacy in treating this disease. There's chloroquine and hydroxychloroquine. So those things are available, along with azithromycin. So we know that data came out from France recently. So be aware how to take care of yourself and how to take care of your loved ones. Call for your appointment.